Okay, so today we are going to discuss Meniere's syndrome and Werner syndrome. So, STEM, men with parathyroidectomy and pancreatic mass. So, um, you should know first what is Meniere's syndrome or Werner syndrome. So, basically, it's a triad. There are three things like parathyroid hyperplasia, means hyperparathyroidism, and pituitary adenoma, and there is pancreatic masses. So it can be anything like, and it can be insulinoma, glucagonoma, and gastrinoma, but most common it's gastrinoma. So now we will go further. How many parathyroid glands are mostly affected in Meniere's syndrome? All the four glands hyperplasia occurs. Define hyperplasia: increase in the number of cells in tissue or organ in response to a stimulus. Define parathyroid hyperplasia: a non-malignant pathology in which proliferation of parathyroid cells and enlargement of the cells. Which cells specifically? The parenchymal cells or chief cells, which produces parathyroid hormone. Causes of parathyroid hyperplasia: renal failure and Meniere's syndrome. Means this can occur as a picture of Meniere's syndrome, or this can also occurs in a renal failure. When there is a renal failure, there will be loss of calcium from the body, so there will be hypocalcemia. So there will be constant stimulation of all the four parathyroid glands, and it will lead to four gland hyperplasia. This is tertiary hyperparathyroidism. In tertiary hyperparathyroidism, this occurs. So we do uh, all four gland excision plus autotransplantation in the brachioradialis, about 8 gram of autotransplantation of the parathyroid gland. Microscopic picture. So you can see here. So we have the oxyphil cells, which are and we have the chief cells. So here the picture is a bit weird, but the oxyphil cells, these are eosinophilic. These eosinophilic cells, eosinophilic, and these chief cells are the basophilic cells. These are the these produce, there are chief cells or principal cells, these produce parathyroid. So these cells hyperplasia basically happens. So most common pattern is seen in the chief cell hyperplasia, which involve the glands in diffuse or multi nodular pattern. Okay, so what happens that less commonly the constituent cells contain abundant water clear cell hyperplasia. In many instances, there is island of oxophils and poorly developed delicate fiber strands may envelop the nodules. Okay, so the patient developed a stupor, confusion, and hypoglycemia. Stupor, confusion, and hypoglycemia. What might be the cause? So it can cause insulinoma. So the pancreatic mass is insulinoma in this case. Okay, what cell derived from beta? What cell derived from beta cell islets of Langer's? What other causes unresponsive hypoglycemia? Do you know? Insulin-like growth factor from non-beta cells or pancreas, abnormal insulin sensitivity, diffuse liver disease, inherited glycogenosis, and ectopic production of insulin by certain retroperitoneal fibromas or fibrosarcomas. Uh, so clinical picture of insulinoma: confusion, stupor, loss of consciousness, blood glucose 2.5 millimole or less. These episodes are precipitated by fasting. Or exercise, prompted relief by feeding or parental administration of glucose. So this is called Whipple triad. What are the clinical pictures? What is the clinical picture of insulinoma? So diagnosis suspected in the presence of a Whipple triad. So this is actually Whipple triad. What is Whipple triad? That symptoms signs both consistent with hypoglycemia and neuroglycopenic symptoms like confusion, stupor, loss of consciousness. So this will be occur on one side this, and plasma low glucose plasma, you will have low glucose plasma level concentration at the time hypoglycemia. So hypoglycemia, these features, and immediate response to infusion of glucose. So this triad is called Whipple triad. Okay, so how will you diagnose insulinoma? Biochemical diagnosis: high circulating levels of insulin, less than 10 microunits per ml normally at the time of hypoglycemia. So there will be increased level of insulin, high insulin to glucose ratio, insulin will be higher, and high proinsulin and C-peptide. Oh, so this is very important. So basically insulin is produced in this shape, like insulin and C-peptide endogenous. So when active insulin is formed, this is proinsulin. So when it's active insulin, it is cut, the bond is cut, so it will produce C-peptide and insulin, active insulin. So this will be high. If you inject insulin into somebody, so in that case C-peptide will be absent. So here we have C-peptide. Okay, so here high proinsulin and C-peptide. This is important. Radiology: ultrasound and CT abdomen with pancreatic protocol. But no, the best investigation for insulinoma is endoscopic ultrasound. This is the best investigation of choice. Gold standard is EOS, endoscopic ultrasound. Okay, so what do you suspect as another pathology in this patient? What do you suspect as another pathology in this patient? Pituitary adenoma MEN1. So I told you at the start that MEN syndrome is composed of three: parathyroidism, hypoparathyroidism, pituitary adenoma, and most common pituitary adenoma is a prolactinoma. And this pancreas may be, gastrinoma is the most common, but here it's insulinoma. So define MEN1 syndrome: group of condition inherited as autosomal dominant, fashion characterized by hyperplasia of or neoplasia of endocrine organs. Group of condition inherited as autosomal dominant, which are characterized by neoplasia or hyperplasia of the endocrine organs. What are the 3 gene mutation in insulinoma? So the 3 gene mutation in insulinoma are MEN1. This is the most important. And loss of function mutation in tumor suppressor genes such as PTEN and TSC2. And the other is inactivated mutations in 2 genes: alpha thalassemia, mental retardation syndrome, X-linked. Okay, so MEN1, which causes familial MEN syndrome type 1, also is mutated in number of sporadic and neuroendocrine tumors. So one is MEN1. Okay, so the PTEN, this is very important. TSC, which results in an activation of the oncogene mammalian TOR, mTOR signaling pathway. An activating mutation in 2 genes: alpha thalassemia, mental retardation syndrome, X-linked ATRX, and death domain associated protein DOX, which have multiple cellular function including telomere maintenance. Okay, this should be repeated again and again to learn this. I will also share a picture of this in a very simplified form. We have to simplify these things. What are the genes responsible for cancer in general? So in general, not associated with MEN1, generally we have tumor suppressor gene, mutation of proto-oncogenes which will be converted into oncogenes. Proto-oncogenes, tumor suppressor genes, microRNA genes, mutar genes, BRCA1, BRCA2. These are in general in cancers. Okay, So what is two-hit hypothesis? So, like all genes, tumor suppressor genes may undergo a variety of mutations. However, most loss of function mutations that occur in tumor suppressor genes are recessive in nature. They are recessive in nature. So they basically, the tumor suppressor genes, which normally suppress the tumor cells, they loss of function mutation occurs. So they lose their function. Thus, in order for a particular cell to become cancerous, both of this cell tumor suppressor gene must be mutated. We have two alleles, so this must be. This idea is known as two-hit hypothesis. Okay, what is telomere? A telomere is a region of repetitive nucleotide sequences at each end of chromosome, which protects the end of the chromosome from deterioration or from fusion with neighboring chromosomes. What is apoptosis? Programmed cell death is called apoptosis. Okay, so let me explain this thing. Let me explain this thing for you. So we know that all our body characters are controlled always by pair of genes, which are called two alleles, this and this. Okay, always they are in pairs. So tumor suppressor genes mutations, these are recessive. What they are recessive. So what this means that if tumor suppressor genes mutation have to occur, have to expressed in the population, so they, since they are recessive, so recessive always required to hit the to both, to mutate both. If one is mutated, it will not express, it will be just a carrier. But if you hit both, so this will result in cancerous cell. Okay, so this is the concept. Okay, so this was the yeah.